Meanwhile, the number of COVID-19 cases in Hong Kong continues to rise, with 73 new cases reported today, now 66 of which are local transmissions. As the city struggles to contain a surge in cases, health experts are calling for tougher measures like a partial lockdown to stem the virus spread.
Their warnings come after Chief Executive Carrie Lam described the situation in Hong Kong as really critical on Sunday, with more than 500 infections confirmed in the past 2 weeks. The city hit a record number of COVID-19 cases in a single day at 108 on Sunday, of which 83 were local transmissions.
Joining us to share more on the situation on the ground is Hong Kong correspondent Claire Huang. Hi Claire. Now Claire, previously we spoke on how Hong Kong had impressive success in tackling the virus, learning from the nightmare of SARS in 2003. The people wore masks, maintained a high level of hygiene and practiced safe distancing, which helped to keep the numbers in the city low. How then did the flare-up happen? Are the authorities able to identify the source of this new wave?
Hi, so the short answer to this question is a relaxation of rules. From Easter break in April, people were quite relaxed, and then you saw them coming out, tanning on the beaches, it was packed. We had photos of that, and that's because they were cooped up, right, at home for weeks. So, they decided to have a little bit of a sort of a holiday feel. Now, then the numbers went up, everyone started staying at home again. So this is essentially a repeat. And look, it's not something that is only peculiar to Hong Kong or that we don't expect or, we're not warned of. It could happen here, it could happen anywhere by virtue of the fact that COVID-19 is highly infectious, right? So from Father's Day onwards, the rules were gradually relaxed, then from 4 persons maximum in public gatherings to 8 to 50. And then on July 9th, the government said too many clusters in too many areas. So it was worrying because the authorities couldn't tell, where the sources of infections were from for quite a number of those cases. So health experts here have pointed to eateries as one of the culprits, because when you go out and you dine in, you take off your mask, you talk to people. So this was an aggravating factor that they pointed out, and we've got other clusters like elderly care centers were also one of the hot spots. Same theory here. You have, it's the same theory here with dormitories. You have a lot of people in a limited space, So once you have a case in there, it spreads like wildfire. There are also a number of taxi drivers who have gotten infected, possibly because of passengers and so on. So the worrying thing now for the government is that a lot of the sources of infections are unknown.
Right. Well, on that note, Chief Executive Carrie Lam had announced more regulations to tackle the escalating situation, including making mask wearing compulsory inside any public indoor venue and issuing a new order for non-essential civil servants to work from home. So, Claire, is Hong Kong looking to impose a lockdown like how other countries have done to manage their second wave if the situation worsens in the city?
Yes, at least one health expert from the Hong Kong University, microbiologist Professor Yuan Kok Yong, said today that a lockdown, not a full one, not total, but it would be necessary if the surge continues. Other health experts are saying that people have become relaxed. So they're now telling the public the onus is on you to, like the individual, to bring the numbers down. And right now it's worrying because there are only 196 units left at quarantine centers. Public hospitals may not be able to deal with any more surge in numbers. So the experts have warned. And as it is, testing facilities are swamped. Private hospitals are fully booked for the day or even the week. The private labs that are helping with testing of COVID-19 are also full. People are taking a longer time to get their test results back. But the silver lining is that the government has plans to build quarantine units in Lantau, as experts warn of a winter season wave. So we've got 700 units to go on stream this week. and then another 800 to be ready by end September. So in all, 3,500 quarantine units at Penny's Bay by the end of the year. And then, we have also got Hong Kong's sole delegate to China's top legislative body, Tam Yu Chong, today saying that the September 6th Legislative Council elections, that the government should not rule out postponing the LegCo elections. So this is what's happening so far.
Now, on that note, Claire, just to shift away from the COVID-19 situation in Hong Kong, now separately, Britain is also set to suspend its extradition treaty with Hong Kong in a further escalation of its dispute with China over the introduction of a security law in the former colony. What are the possible implications from this move?
Well, Britain is not the first, but it is the latest among the Five Eyes members to cut off fugitive transfer arrangements with Hong Kong. Canada and Australia have suspended their treaties with Hong Kong. And then the US was preparing a similar move last week. And then New Zealand is now reassessing the legal instrument as part of what they call deliberate, considered review of its relations with Hong Kong. Now, this all comes after the passing of the national security law, of course. And in particular, we have got the US President Donald Trump, who recently issued to order the end of Hong Kong's special status. And also he started the ball rolling on sanctions to be imposed on individuals, entities, and financial institutions under the Hong Kong Autonomy Act. So when you have all these coming in together, right, in the wake of the national security law, we can expect more countries, perhaps in the West, to actually make a stand and have a position on this.
Well, thank you so much, Claire, for coming on to the show. Always a pleasure to speak with you, and of course, as always, stay safe. Now, we were speaking to Hong Kong correspondent Claire Huang.